So today we are here to talk about Dinacharya for faster and better sleep. As Shivani introduced, that I've been practicing Ayurveda since last 18 to 20 years in Maharashtra, Pune. During my practice, I see many patients, and while examining them, it has been observed many a times that majority of the people or the patients I see, the hidden cause is deranged lifestyle. And with that purpose only, when I realized and when I advise people to correct, uh, to make some certain changes in their lifestyle, things are like repaired within a few days, and it is sustainable. It is that change lasts for the longer time. With this concept only, we've started with Charyā Ayurveda. Now, Charyā is a routine or is a protocol which is set for any routine or anything you do on a regular basis. So, believe me, in Ayurveda, everything you do, there is a protocol or a regime explained for everything, which will not only balance your dosh but also increase your longevity and health and immunity for a longer time. So, with this, we started with Charyā Ayurveda. Today, the topic is sleep deprivation, or as Shivani said, sleep deficiency. Now, as she said, that sleep deficiency is something we might not even realize that we are going through many a times, and nobody often speaks about it. But worldwide, if you see the data, there are 20 to 30% of the world population usually go through problems like insomnia, lack of sleep, and many other issues which are related to sleep or which are the result of sleep deprivation. So, sleep is something which is really essential in life, which is a repair mechanism of our body. And this depreciation can be a reason behind minor symptoms that we face every day to a major life threatening conditions like cardiac health or obesity or hormonal imbalance. Now, during my practice, when I examine patients, many of the time, when I ask them about sleep, almost 8 out of 10 people will say, yeah, they have some problems. So either the sleep is not sufficient, or it is not a deep sleep, or they can't fall asleep very fast, or any sort of similar complaint. So, to cite an example, I had a patient few years back, 26 to 27 years old male. He was he during his work he had some deadlines, and which he had to finish his task within a short period, and he had that stress. During, just to assure that he complete his project within time, he worked 4 days continuously and hardly managed to get a sleep for around 2 to 3 years. With At the end of 4 days, he had problems like a severe headache, raised BP, blood pressure, and he ended up having facial paralysis. And for that, you know, he had to undergo treatment for next 1.5 months to get back to normal. So this is what sleep deprivation can result into. Another patient who was around 45 to 50 years old female had some small minor issues in her family. She had the habit to continuously think about small issues. This all this mental health issues related in having disturbed and inadequate sleep. She used to fall asleep by around 12:30 and wake up early morning by 3 a.m. Like post that she couldn't sleep. And this continued for around a month or so, and suddenly she faced problems like severe weight loss, weakness, fatigue, darkness in the complexion, hair fall, and whatnot. So when we started treating her, when I started treating her, when I took the history, the major concern here was not about her nutrition or not about her other medical issues, but only sleep. And only when the sleep was treated, she came back to normal. So, friends, this is uh, just an example to show how important sleep is in our daily life. Considering this, and Ayurveda has always mentioned or always given an important place in our daily routine for sleep. So, in Ayurveda explains Trayopstambha, that is a health triad. The three important things or three important pillars of our life which can keep us healthy and also give us long life. The three of them are Ahar, Nidra, and Abrahmacharya. So, Ahar is our diet, Abrahmacharya is celibacy, and Nidra is sleep. It is not a surprise that sleep is given such a big importance, as we all know that sleep is a repair process or a rejuvenating process, a rest for all our body, physical and mental activities throughout the day. So, what does adequate sleep give benefit you with? So, when you have adequate sleep, Ayurveda explains it is the reason for your health. So, nidra yatam sukham dukkham pushti karsha balabalam vrushata klibata adnyanam jivitam nacham. So, it means when you have adequate sleep, it will benefit you with all the happiness, your health, strength, libido, your nourishment, and your healthy life, a healthy immune system. And the opposite is true if you don't have enough sleep or proper sleep. So many of the time people feel that sleep is when you just close your eyes and lie down. Shut eye is not what means sleep. It can be a rest, but if the sleep is not sound, if it is not peaceful enough, then it would severely affect your health. So coming back to physiology of sleep. So Ayurveda has studied or explained sleep in detail. So basically, why do you fall asleep? So when um, for for you to fall asleep, there should be certain level of dosh balance. When I say balance, it should be pitta dosh and dosh should be normal in normalcy or in a lower phase, and kapha should be slightly higher. When this stage is attained, you fall asleep. So there are types of sleep. So people may feel sleepy for the whole day, they may feel drowsy, or they may have sound sleep. But a natural sleep or healthy sleep is something which is known as Manas Sharir Shrama Sambhava or Ratri Swabhava Prabhava. So among the six types of sleep which Ayurveda explains, the one which is induced due to physical and mental exertion at the end of the day, that is at night preferably, not a daytime sleep. This is the ideal sleep which your body needs and which is helpful. The other sleeps which are like agantuki, which means you feel drowsy or you feel sleepy unnecessarily any time of the day, or sometimes when you are severely ill, there is weakness and you feel sleepy. This is Vyadhi Anuvartani. That means when you are suffering from certain ailment, you feel sleepy or weak. That is something which is not a natural sleep. It is surely a repair mechanism of your body, but that is not the ideal sleep which your body needs. Ratri Swabhav Prabhava means the sleep which is induced naturally at night time is known as a natural sleep. And the another sleep, which I mentioned, is due to the physical and mental exertion. So, as you all know, that there is a biological clock or nature clock which is going on in our body, that is known as circadian cycle. So, this, according to Ayurveda, your body and the dosh are correlated. So, during the day and night, each of the dosh has its dominance in a particular time of the day and night. And so, accordingly, you need to perform or practice certain activities during that time of the dosh. So, this helps to maintain your dosh equilibrium and health and immunity. So, if you see between 6 to 10 a.m., 6 to 10 of morning and evening, it is the kapha dosh which is dominant. Between 10 to 2 p.m. or 10 to 2 a.m. at night, it is the Vata dosh, it is the Pitta dosh, which is dominant. And Vata dosha has its dominance during 2 to 6 p.m. and 2 to 6 a.m. That is during day and night. So, as I mentioned, that kapha has to be um, in excess, and vata and pitta dosh has to be in normalcy or in a lower quantity if you have to have a proper sleep. So, if you see, if for the healthy sleep to induce, it should be you should start the process or you should initiate to slow down after 6 p.m., and you should go to sleep between 8 to 10 p.m. So to have a peaceful sleep. Between 10 p.m. to 2 a.m., it is the pitta dosh which is dominant. And so this is the time when you have deep sleep, when you have sound sleep, and your subconscious mind is in action. Post that, between after 2 a.m., this is slowly, gradually, vata dosh starts getting active, and it starts generating activity in your body. It starts initiating movement in your body. And so by the end of 4 a.m., it is which is known as Brahma Muhurta in Ayurveda, when vata is really activated, it is the ideal time to wake up. But any time between 4 a.m. to 6 a.m. is the right time that you wake up. You start your day early, so that elimination of waste and your dosh balance and your vat movement can be activated. So this is the, so if you see this biological clock, it means that the ideal time to start your sleep should begin from 8 p.m., and you should end it up or wake up by around 4 to 6 a.m. in the morning. That would freshen up your body, induce immunity and health to you. So when you see, as I mentioned, so how is dosh and sleep related? So when you this is what we talked about, normalcy of sleep and normalcy of your dosha. So what, when we have to talk about abnormalcy or any disorder in sleep or sleep related issues, it is the dosh which gets vitiated or disturbed. Dosh balance is hampered. So any activities you do which can increase vata or pitta dosh sorry, can lead to sleep imbalances. Similarly, if kapha dosh is reduced, or there is a lot of dryness or reduced kapha in your body, it can lead to sleep disorders. So each dosh, so if the vata dosh is increased, it can lead to nidra nash. When I say nash, it means loss of sleep, a complete loss of sleep, or lack of sleep, which can also be known as insomnia. Whereas if pitta dosh is increased, it will lead to nidralpata, or inadequate sleep or disturbed sleep. That means you can fall asleep at right time, but you can wake up early morning, or you will have disturbed sleep, or you may not have a sound sleep. So many times we see people that they sleep for 6 to 8 hours, no doubt, but still they, when they wake up in the morning, they'll say, I'm like, I don't feel I've slept all the night. I don't feel fresh, or I feel the weakness, or I need to sleep for some more time. So it is not about the quantity of sleep that you get, but the quality of sleep which you experience. So if the pitta dosh is increased, you might seem to be have fallen asleep, but the quality won't be good, and you will feel lack of sleep. Whereas if kapha dosh is decreased or reduced, you will feel experience anidra. Anidra is not that you don't sleep well, but you won't be able to fall asleep. So there are patients when they say, I go to bed by around 10 p.m., but I don't fall asleep by almost 1 to 2 a.m. So I'm awake till 1 or 2 a.m. and then I fall asleep. And then that is the reason I don't feel like waking up early in the morning. And the last one, when kapha dosh is increased, so this is a vikruti again, it will lead to excessive sleep or drowsiness or lethargic condition. Okay, so many a times, as I mentioned, that people don't even realize that they have sleep imbalances. It is because they think that, okay, I go to sleep by around 12, 1, and then I wake up at 8, some 7, 8. So I have sleep quantitatively by for around 6 to 8 hours. And so, yes, I'm experiencing sleep. But they have certain symptoms that they don't feel fresh, they are lethargic, or there is some mental confusion or memory loss going on a daily basis, some minor symptoms here and there, mild headache or something. So what, how do you know that you have sleep imbalances? So certain symptoms like certain conditions, what people experience is inability to fall asleep. So they go to bed at around 11, 10:30, 11 or something, but they're not able to sleep by late night. Second thing, they sleep at right time, but many of the time they wake up too early, like at around 3 a.m., and then they are not able to sleep, or they wake up frequently. They have a disturbed sleep. They wake up every 3 to 4 hours, 2 to 3 hours, and then it becomes difficult to fall asleep again, and so they waste almost 30 to 40 minutes in falling asleep. Or even they have a sound sleep, they like many of them don't feel energetic when they wake up. So again, there is a condition known as sleep apnea, wherein you feel that people are sleeping, they even snore. People continuously keep on snoring at night, and they are in semi semi conscious state, you can say. So in this condition, because there is lack of oxygenation to the brain, or there is any obstruction in airway, so it may be enlarged tonsils or swollen nasal turbinates. In that case, people sleep, but they don't experience sound sleep. Next thing is restless leg syndrome, wherein, I'm sorry, wherein people, many of the patients, they experience lightness in the feet. So they feel that their feet is floating, or on the contrary, they may feel that their feet are very heavy. They have some irritation at the on their legs, etc. So again, this results in disturbed sleep. And then is the last condition known as narcolepsy. So people sleep, so they have semi conscious. They sleep in semi conscious state, and for the next day they are drowsy, they don't even realize that they are dozing off. So they are working something, and they might just take a small nap without even realizing that they are sleeping. So this is a severe condition wherein people really need to improve their lifestyle. They really need to get treated for it. So these are some sleep imbalances. So what how does lack of sleep deficiency affect your health? Is according to text, it is mentioned that Angamarda, Shiro Gaurav, Jrumba, Shirashul, Jadya, Glani, Brahma, Apakti, Tandra, and Vataram. These are the symptoms mentioned in text, which is a result of inadequate sleep. When patient complain with varied symptoms, like many of them experience body ache, irritability, confusion. So people have the tendency to fall ill very frequently, so they may have frequent cough cold episodes or fever episodes. Many of them experience memory loss in the sense they don't remember where they have kept their things, or they open their like switch on their phone screen, and then they forget what they were exactly searching for. And very common conditions which we see is dark circles around the eye, fatigue. In kids, if they have lack of sleep, it is they experience impaired growth. So height remains stunted, or they look weak or malnourished. They are not able to focus on their studies, lack of concentration. And major complaints like cardiac risk, weight gain or obesity, and hormonal imbalance is one major thing which many of the people they experience, and these are all metabolic disorders. So I think by now you must have realized how important sleep is, because many of the time people say, like, it is the time that it is the I'm too young, and it is a time when I have to really work, or I have to party hard, and then okay, it is okay, I can manage with 4 hours of sleep, and then things will be fine. But if this lack of sleep or inadequate sleep situation continues for a longer time, it can affect your body seriously. So coming back to what are the causes of sleep, one important factor is age. So as the you must have seen that small kids, they sleep for a long time. They can sleep at night for almost 10 to 12 hours. They again sleep during the day. Whereas as they age progress, basically usually after I think 60 years of age, 55 to 60 years of age, your sleep time or sleep span reduces gradually. Now, this is because as you start aging, Vata dosh has its dominance in later phase of your age. And due to this, it is the reason that people experience lack of sleep during the later age. So there are certain practices if you start implementing in your daily routine, this problem uh, can be brought into control. Another thing is like stress. Certain medications which you are on can lead to lack of sleep. Emotional or psychological conditions like anxiety, stress, depression can be one of the factor for sleep deprivation. Constipation is something, or constipation or gut health is something which can also affect sleep, because um, unless you eliminate your waste out of your body, or you are not having a healthy diet, it can impair your digestion. And with this, there is a arm accumulation into your body which can result in high toxic level, and this can impair again vata movement in your body and lead to sleep deprivation. A very common thing which I think everybody of us go experience is excess screen time. So it may be a TV screen, it may be blue light, like using your mobile while going to bed. People have the habit to go to sleep while they're on experience, like while they're using Instagram or Facebook or reading something on their mobile or exposing to screen. And this is something which can severely hamper your sleep. So it can not only affect um, delay your sleep time, but it can also affect on your quality of the sleep. Again, addictions to alcohol, smoking, or caffeine is something is the cause for sleep deprivation. One important thing is starving or excessive fasting. So people have the habit to not have sufficient diet just for the weight loss sake or any other reason, and this again results to vat accumulation into the body and lack of sleep. And uncomfortable bedding is one of the thing which can cause sleep deprivation. So, friends, when I say sleep is important in your life, it plays a major role. So you can check your sleep pattern, or you can really analyze your how you sleep and your overall lifestyle. That is Charyā, on our Know Your Charyā app on our website, wherein you can fill the questionnaire and get a result of how a health score of how your lifestyle is. And with that, we also it also generates a data driven report and remedies or steps how you can improvise your lifestyle and attain health. With that, again, you can come back after a few months and again check your health score about how you're gradually improving. So you can surely visit Know Your Charya and get to know about overall your health and lifestyle. So coming back to, now we've known that how sleep affects, how much sleep is important in our daily life. So how to overcome this sleep deprivation, or how to have a healthy sleep as per Ayurveda. So important thing is lifestyle changes. So there are certain lifestyle changes you might have to make in your lifestyle, in your daily routine. So these are not the major things which you have to go, but some minor changes here and there can really help you to attain a healthy sleep. So first of all, it is prioritize morning sunlight and reduce artificial blue light. Means you should work with the nature clock. During when the sun is active, your body is active, and your body receives the energy from the sun. And so it is important that you start your day early and start winding up post sunset, and go back to get back to sleep early by around, as I mentioned, by around between any time between 8 to 10 p.m. Again, planning your work and life family time. Now this is really important, because many of us carry our work after our working hours when you are in the family. Now, why is it important to have family time? Because family time is something which relaxes you physically, emotionally, and mentally, that is psychologically. And this is something very important which to relax your brain and to wind up your day and your bodily activities, so that you can uh, attain again dosh balance and go back to sleep on time. Very important thing is exercise. A minimum exercise of at least 30 minutes in the daytime, that is early morning, is very important. Evening exercise again increases what many of you have the habit to exercise post work, that is by around 7 p.m. or 8 p.m., because gyms are open till 10 p.m. in the evening or 10 p.m. in the night. But when you exercise in the evening, that means you're exercising in the vat period according to the biological clock, and this may increase vat, and it can make it difficult to go to sleep. Last thing is, say no to sedatives, because sedative is something which can make your body dependent upon, and it can hamper your routine and your brain activity on a long term if you're using it for a long period. Seasonal panchakarma is something which can detoxify your body every season. So, as I said, according to biological clock, there is a dosh dominance during day and night in your body. Similarly, with every upcoming season, your body undergoes dosh imbalance. That is, during like upcoming season, now spring season, it is kapha dosh, which is dominant in your body, and can you and therefore individuals can be prone to diseases related to cough. So uh, during this season, Ayurveda generally suggests Vaman as a panchakarma. So this is the seasonal panchakarma for spring season. So similarly for rainy season, it is Basti treatment, and during the autumn season, it is Virachan, that is a seasonal panchakarma. So it is important that even if you don't have a particular condition, you should undergo seasonal panchakarma during that particular season. So this helps you to attain the dosh balance in your body. Then when we say there is a particular Dinacharya and Ratricharya, that is a routine, daytime routine and nighttime routine. So when you have to follow morning routine, it is obviously, as I mentioned, that waking up early before 6 a.m. is important. Regular bowel movements is important. Abhyanga is massage with oil. And I do understand that not everybody has can spare time in their daily routine or busy schedule to apply oil on a regular basis. But areas like head, your feet, and your ears, these are specific sites in your body which should be oiled on a regular basis, not only to pacify vat, but because these are the sites which, now head is a site which has all your sense organs, and your sense organs are governed with vata dosh. And so when you have to nourish your sense organs, it is important that you apply oil on your head on a regular basis. Ear again is a site of important site for vata dosh. And your feet again comes in your lower extremity, and so it is important that you maintain that you massage with oil on a regular basis at these three sites, at least on a regular basis, followed by exercise. Bathing is again um, activity which energize your chakras, which energize your body, and your mind. So it is important to bathe every day, and it is also important that you bath before eating something. So many of the patients, they have the habit to have their breakfast and then they'll go to bath just before leaving for the work. But this is a wrong practice, but because this hampers your agni and hampers your digestion. So and important thing is, you shouldn't sleep during the day hours. Only during summer season, or if you are seriously ill, or you haven't had enough sleep at night, you are allowed to have a short nap in the afternoon. Then coming back to Ratricharya. So when we are planning Ratricharya is, Ratri means evening or night, and Charya is routine. So everybody is used to the word term Dinacharya, but very few know about Ratricharya. So when we have to follow Ratricharya, it comes in three phases. First is slowing down, then self pampering, and then giving him in or going off to sleep. So first of all, slowing down, that means you have to start winding up by, around post 6 p.m. So I do understand people work till 8 or 9, but if possible, you should start winding up your work by 8, and enjoy your time or your family time after post 8 p.m., post 8 to 9 p.m. in the evening. Then, if needed, if you're traveling or if you are really tired, a quick warm bath can help you, because again, as I said, bathing improves your energy chakra. It stimulates your chakras, and it also gives you energy and pacifies vat again. And then early dinner before, like, 9 is ideal time, 8 to 9 is the right time. Post dinner, you can have a small short stroll or walking, and reading or spending time with your family, anything which will relax you, is something you have to do before 10 p.m. Then, as I mentioned, self pampering is, you can apply oil on your head, feet, and ears. Then grita anjan, that is applying ghee, cow ghee, into your eyes. So this is something, because all of us are exposed to screen in some or the other way, and there are radiations coming from this screen, which increases pitta in your eyes, or which hampers majja dhatu in your eyes. And grita or ghee is something which pacifies pitta, which also takes care of your eyes, nourishes your eyes, and also helps to induce sleep. Obviously, it also prevents you from exposure to screen, because when you apply ghee into your eyes, obviously you have blurred vision, and then you can't fall asleep, you can't watch the screen. Then you can either help yourself with a herbal tea, with cardamom or nutmeg, or herbs which, like brahmi or shankapushpi, which can help you to induce sleep. Or if you have to have if you're comfortable with having milk, I would suggest you have buffalo milk when it is related to sleep disorders, because buffalo milk is, increases kapha, and it helps you to fall asleep easily. You can add turmeric, or you can add a pinch of nutmeg powder, just to or ghee, just to have a sound sleep. Then soothe your senses, it means you can, depending upon your choice, you can have soothing music, or pleasing fragrances in your room, or pleasing lights, or comforting warm lights before going to bed. Lastly, bedding is really important. So the bedding which you are comfortable in, which can help you rest your neck, your shoulders, and bed. And so you shouldn't have any pain or discomfort in your bed. Before going to sleep, you can practice meditation or yoga nidra for, few minutes, or you can chant mantra or prayers, anything which will help you sleep. And preferably, you should go to bed by 10 p.m. This is what is Ratricharya, which Ayurveda recommends. So then there are certain things which you should really avoid when you really need good sleep. So as I mentioned, working out in the evening or having sedative pills can have a negative impact. Similarly, screen exposures, or having carbonated drinks, or loud music, bright lights, or lying down immediately after meals, because after dinner is something which you should surely avoid. So after you have your dinner, there should be at least a gap of 1 to 1.5 hour before you go to bed. It is important because if you directly go to sleep, what happens is you may experience indigestion, bloating, or gas trouble, which can seriously, cause either breathlessness or acidic reflux, and it can make things difficult for you to go to sleep. Again, when I said long term of sedatives should be strictly avoided, because what happens is when you start having sedatives, it usually you end up having a depend you sorry you end up getting dependent on it. So dependency is something which is really scary, because when you have sedatives on a long term, it slows your mental ability. It leads to drowsiness, it leads to lack of memory, or lack of concentration. People many of the time they feel restless and forgetfulness, or it can also severely affect your liver or kidney. Last thing is, when you try to go off the sedatives, it can also have withdrawal symptoms, like you have withdrawal symptoms for smoking or caffeine or alcohol. Even sedatives can have withdrawal symptoms. So it is generally advised to taper off sedatives, or to stop having sedatives with under medical guidance. Nextly, regarding diet. So, diet also plays an important role when it is related to sleep, when sleep is concerned. So, as I mentioned, we should have early dinner. So, early dinner means before sunset. But considering present situation, eight dinner before 9 p.m. is the ideal thing. It is important that you don't have oily or cheesy food or a late night dinner. So many of the times when I consult patients, when they have night shifts, they usually have the tendency to munch something throughout the night, or they'll have late dinner at around 2 a.m. in the night, and this is really not advisable, and this has its impact on your overall health. Again, there's something which you can have light dinner, which is warm and which is easy to digest. Because if you have digestive problems, then it can lead to acidity or gastric reflux or bloating. And then if you have bloating or any chest pain, stomach pain due to improper food, it can hamper your sleep, or it can disturb your sleep. Similarly, kapha increasing food like milk, porridges in small proportion, you can surely have ghee in your diet for better sleep. Now, when I see patients, many of the time these days, at least I notice that people have a tendency to cut off sweets completely, and they really feel proud that no, I have stopped my sugar completely, or I've stopped having sweets completely, because sweet is not something advisable for your health, and it can have bad impact. But Ayurveda suggests that you should have all the six tastes in your diet, on your routine, because each taste that you have, that like all the six tastes, sweet, sour, astringent, spice, pungent, or salt, has a role to play in your health. It balances your doshas, it balances your immunity, it balances your dhatu texture, everything. So sugar, not exactly sugar, but sweet taste is something which helps in rejuvenating your body, in regeneration of your tissues, or which helps you to keep your mind active. And when I say sweet, it is not that you have a lot of sweet dishes, but it is natural sugar that you should consume. Like you can find natural sugar in your rice, in your wheat, or fruits, milk. All kind of natural sugar is supposed to be eaten on a regular basis, just for your maintaining your health. Because when we say that sleep is some a process wherein your mm, body organs and your physical activity and your physical activities need rest, also your mental activities at its rest, and it is in the rejuvenation or repairing phase. So sweet taste is something which helps in this rejuvenation, and also building up your energy for the next coming day. Mm, Okay, then coming to your treatments. So, when you think that you have sleep issues and when you need treatment, it is very important to first know the reason behind your sleep. So, there are two basic factors, that is Sharir and Manas, that is physiological and psychological factors which can affect sleep. When we see physiological factors, it again has two things: external treatments and internal treatments. And so treatments which you like external application when that can help you induce sleep, those include body massage, basti process, treatments like shirodhara, shirobasti, nasya, and karnapuran. Karnapuran is applying oil into your ears, and exercise. Internal treatment can be herbs, or herbal teas, pacifying herbs, or medicines in general. And psychological treatments can include chanting of prayers, onkar, meditation, or counseling in some cases, and pleasing music or pleasing fragrances. These can help if you have particular problem. So, as I said, when we anybody has to go for treatment, it is very important to first know that whether the reason behind sleep deprivation is physical or psychological. Once if we come to a diagnosis that it is a physical reason for the sleep deprivation, then it is important, as I mentioned in the first slide, that excess vat and excess pitta or reduced cough is the reason behind sleep deprivation. So then we have to first diagnose that is it vat that is increased or and kapha that is reduced. Then we should resort to process treatments like abhyanga again, as I mentioned, abhyanga or oil massage on head, feet, and ears. Then nasya is something that is instilling mm, ghee or oil into the nose. um, Helps relax your senses, helps relax your mind, and nourish your senses, and this induces good sleep. You can apply oil, bath pacifying oils like Brahmi oil, Jatamansi oil, or fragrances of Jatamansi, or plain sesame oil. This helps pacify bath and induce sleep. Then nourishing diet and medicines. As I said, you can have a cup of milk with ghee or cardamom or turmeric or nutmeg. This helps in inducing good sleep. Activities like pranayam and yoga nidra, specifically pranayam, only deep breathing, like if you're not very used to pranayam exercise, it is advised that you do it only under a guidance, or you learn it from someone, an expert, or only deep breathing or focusing on your breath is something can help you fall asleep. There are certain music available on internet which you can play with avoiding screen. Of course, you can help yourself to fall asleep. Then the second aspect, if it is that pitta dosh is increased, so you may have irritation, or you may have anger issues, or you may feel restless, or there is in some people they feel experience a lack of like excessive itching in their body, or rashes on the body. Now this can suggest that pitta dosh is increased. In that case, abhyanga or padabhyanga should be performed with calming oils. It can be coconut oil or ghee, or oil medicated with sandalwood or chandanbala laksha oil. This helps pacify pitta. Nasya can be performed with ghee or milk or coconut oil in case of increased pitta dosh. Instead of milk, if you don't like milk, you can resort to buttermilk or ghee in your diet. Then floral fragrances and soothing music is an excellent treatment for pitta in general. So when have to fall asleep, it is advised you can follow. You can just have dim light and have floral fragrances in your room. If you're practicing pranayam, Shitali and Shitakari are the two practices which in pranayam which helps you cool down your body, and this can also help in inducing sleep. This you can perform this in any time of the day, especially in summers, or if you have any pitta ailments. Shitli and Shitakari pranayam really helps. Then coming back to medicines or herbs which are mentioned in Ayurveda. So herbs like so as I mentioned, depending upon if it is increased vat, increased pitta, or reduced cough, it is advisable that you consult a doctor and then start with some medicines. If you are not, if you don't feel asleep, get a sound sleep with only milk and ghee or music, then I think you are overloaded with stress. It is advisable you start with some medicines which will nourish your brain. So Ayurvedic medicines, when some of you may question that if sedatives is something which can make you dependent, then why even Ayurvedic medicines can make you dependent on certain for sleep. No, but I would say it doesn't do that, because Ayurvedic medicines, when we give this herbs, it works differently. What it does is it relaxes your brain. It doesn't slow down the mental ability, but it relaxes your brain. At the same time, it acts as a brain tonic. It will nourish your brain tissue. It will nourish your body. So if there is fatigue, it will nourish your body. That means it will increase kapha dosh and reduce vata and pitta dosh, and thus it will help you getting enough sleep. So herbs like ashwagandha, shatavari, brahmi, these herbs, they'll strengthen your body, strengthen your sense organs, and also strengthen your brain. It would increase kapha and then induce sleep. Herbs like tagar and jatamausi, or even brahmi and pushpi, relax your brain. It improves your mental ability. It doesn't have a side effect like memory loss or cognitive impairment, but it helps you in nourishing the brain tissue and reducing kapha in the in the sensory organs or sensory area, and thus it makes you induce sleep. If you're not very comfortable with powders, there are tablets available with these herbs also in concentrated form, or medicated ghee available, like ghee medicated with these medicines or these herbs also help you in having a good sleep. Um, Medicines like Saraswatarishta is something which again has elements like metals like gold, which is again a inner brain tonic. It has Brahmi in it, which nourishes the brain, which improves the immunity, not only on physical levels but emotional, psychological, and mental health. It reduces stress, even it reduces stress, and so these are the suggested medicines. Herbal drinks or herbal teas, like you can make decoction of ashwagandha, jatamausi, shatavari, and then have it like before going to bed, like half an hour before going to bed. You can add a teaspoon of ghee to it. I do understand that these making decoction is a process which also takes time and which is also a bit tedious thing to do. So with that, with same concept, we at Charyā Ayurveda have introduced like two depend drink kadhas, which are easy to make, which are already prepared kadhas and then compressed into granules. So what you have to do is just dip one tea bag pack of kadha granules into half a cup of warm water, and then within a few like half a minute, your kadha would be ready, and then you can sip this warm kadha, which will not only pacify vat but relax your brain, nourish your brain, and relax your senses, reduce vat, and uh, induce good sleep. This also helps, like Swapnacharya is for a good sleep, and and Shanticharya is to to reduce stress. So these are the two products, Swapnacharya and Shanticharya. Sorry. Again, as I mentioned, exercise, any kind of exercise for at least half a minute during morning hours is recommended for good sleep. So, certain yoga practices like Onkar chanting, Anuloma, Viloma, Sitkari also helps. There are yoga poses like Balasan, which is, I'm sorry, child's pose, wherein you cuddle all your like feet and hand inwards, and and just relax your body. This helps in inducing sleep, having relaxing your body. Again, shavasana is is in is a pose wherein you relieve tension or relieve pressure from all your body organs. Now yoga teachers can instruct you well with this, but these are certain yoga postures like balasan, shavasana, Paschimottanasana, Bhujangasana, which helps you induce good sleep. Again, Vajrasana is something, is a position, yoga pose, which not only helps you sleep, but it improves your digestion. And when your digestion is improved, you don't have problems like bloating or abdominal discomfort, which can result in chest discomfort during sleep. So these are the certain poses which you should follow um, for sleep. So now I think for Dinacharya, to sum up, it is your daily routine or improving your lifestyle, daytime lifestyle. You following a certain protocol during post evening till night. So that is known as Ratricharya. So Dinacharya and Ratricharya is something which you should follow. A good diet, well nourishing diet, which includes all the six taste, which is soothing to your senses, which would reduce vat, which would help in digestion, and is recommended. And there should be an interval post your dinner and before going to bed. So at least a gap of 1 hour between your dinner and going to sleep is important. I do understand that it is not easy that you start following this these start implementing these changes and you can fall asleep like immediately. It is a matter of consistency. It is a matter to discipline, to implement discipline in your daily routine. So small changes on a regular basis for a long term and with consistency can surely help you, your sleep, your overall health, your immunity, and longevity. So with this, I think I'm done. um, Thank you for everyone for the patience listening.
Before suggesting everyone to create that alterations in your life, it is advisable that you should visit Charyā Ayurveda's website where you actually um, fill those questionnaires and get a Charya score for yourself and that remedies